last thing. If you're gonna do something, do it long term. So like, not just one semester or a couple days a week. Like, do it for an extended period of time. The reason that I'm at this panel right now is because my freshman year I found out about peer health exchange. I worked with peer health exchange for 3 years. Then the person who used to run work in peer health exchange with me, Christina, she put me on to GlobeMed, and then I worked with GlobeMed. And so it's really, but people aren't going to advocate for you unless they know that you have a good work ethic, that you're going to be invested in something, and that they can rely on you to follow through, because that reflects on them. So if you do something, do it, and do it to the best of your ability.
And real quick, I'm sorry, I don't want to run over on time. So if you have a card or any way to contact people or people to contact you, put your LinkedIn address on there. But also when it comes to networking, use the network that you already have before you start to try to branch out. So if you're on LinkedIn, you can ask your friends or people that you're connected with to write recommendations for you. And so that could be this like a short paragraph, like we were in class together last semester, we were study buddies. Can you write something that would make me look good in 5 sentences, and I'll do the same thing for you. Just a natural exchange that you can do on LinkedIn.
Good idea. Question in the back?
Oh, my question was, it was kind of answered, but what can we do as undergraduates to start making an impact on global health, and what did you do as an undergraduate that you felt was impactful?
GlobeMed, you could join GlobeMed. No, I mean, there's so many opportunities. You can join GlobeMed, you can, we kind of talked about it a little, like volunteer with that within your community. If you talk to us after, I'll give you a whole list, and then I'll send you an email with another list. So just, there's so many different ways to do it, just immediately or long term.
I would say volunteering is another way, or even if there's some type of exchange program as an undergrad, if you're interested in global health, there are a lot of volunteer exchange programs where you can go over to another country for 3 months and actually do work within a community there. So I would say that's one way as well, and you never know what those opportunities may lead to. Like for one example, since I came here as an undergrad, I would say July 2007, since then I've been volunteering with the DC Great Crisis Center, but now I sit on their board of directors, which I actually chair, and that happened within about 8 years after being involved with them. So those are different ways, I would say, volunteering, and just seeing what other things are there you can get involved with. Cameron said GlobeMed is one of those things, so, and there's also a lot of different NGOs, international NGOs that also do recruit for volunteers as well.
As an undergrad, I was a journalist on my way to business school. I didn't think about global health all that much, but as a writer and as a reporter, I would often write about housing. Richmond at the time had a 5-year plan to knock down all the housing projects. And so I made it my duty as a journalist to use investigative reporting to write about that. Because what are you going to do with the people, that you're displacing? And so from that way, I kind of got into HIV, because you're going in covering communities, and communities are saying, we're getting pushed out, but we need these services that this community serves or renders. And so I would say volunteering part, traveling if you can, finding ways to pool your resources with your friends, your classmates. I know if we're going to keep it as real as possible, I remember when I was in undergrad, we would put our money together to go and drink. Go to the liquor store, we get a bottle, we pull our resources together. What about pulling our resources to do a GoFundMe, or to do a car wash, or to do a matching type of donation, going to different organizations, churches, and different religious organizations that say, we want to do this in this community, can you support us in that way? And just using this university and all of the people that are around you to launch those different initiatives. Because what's frustrating in global health sometimes is that you'll have maybe 5 years of experience, and you'll have 3 internships, and you might find yourself unemployed. But if you continue to reach out and you continue to invest in your community, you won't miss meals. You won't you will always have a couch to crash on because you're giving of yourself, and your community will also, you know, make sure that you're taken care of.
Love it. Any other questions? All right, so I just want to just echo my thanks again to everyone who's come here tonight in this gloomy weather. And just really thank you all for coming and sharing ideas and allowing us to have this chat together.